You ready? You got me running.
I am Meredith Hirsh, and this is Working Healthcare. I just interviewed Dr. Patricia Boulogne, and what a fun conversation we had. She practices functional medicine. She's a chiropractor. She's an acupuncturist. She's an author. She wrote a book titled, Why Are You Sick, Fat, and Tired? She really is such a, I want to call it, cool cat. We talk about the 5 pillars of health, and you will feel her positive energy radiate through the microphone. I hope you enjoy this conversation just as much as I did during the interview. Dr. Patricia Boulogne, welcome to Working Healthcare.
Love being here. Thank you so much for the invite.
I'm so happy to have you here in March during Women's History Month. You and I spoke, and after our short conversation, I said, definitely in March, I want to get you on the podcast now because you and I are all about female empowerment. You are a chiropractor, an acupuncturist, an author. You work in the functional medicine realm. Why did you choose to start your journey in chiropractic medicine?
Well, in chiropractic medicine, I had all the same prerequisites pre-med, and all my friends became chiropractors. And so each one of us went to school at a different time, but all of us ended up going there. There's about 8 of us that studied together. So that's how we all ended up there. But science has always interested me. Health has always interested me. I'm sure you're going to think I'm absolutely crazy, but when I was 8 years old, I used to think that I could train bees. And we would take the honey from different plants, from flowers in my mother's backyard, and we would take it and we would eat it. And I just thought that you should be able to control them better. And if we control them better, we could have more honey than just a drop of it. And so I had this crazy idea that when I was 8 years old, that I could control these bees and I could have them make more honey. If we had more honey, we would be healthier because honey was considered a health food even then.
And how did that integrate with chiropractic medicine?
Well, because it all starts with what you eat. And what my teachers that I had when I was in chiropractic school were, like, one of my favorite teachers was my nutrition teacher. And he said way back in 80 something that you should never eat margarine. And he explained why. He drew it on the board. And then the biochemistry teacher came in and he explained his version of it. But we just learned to eat better, even starting back then. And when you started to eat better, I had things that happened with me internally when I was in chiropractic school. Like, I no longer had migraine headaches. And the only thing that I changed is I got adjusted and I ate well.
And that's impressive growing up in the Midwest, because I would think living in Michigan, I would always have a migraine headache. But especially with seasonal depression, right?
Well, you would too, because also there's a lot of pollution. That's, where I grew up in the suburbs of Detroit.
And then you went from chiropractic school and you migrated your way into acupuncture medicine. And then you went into functional medicine. Describe that journey and why you chose to go that route.
Well, when I went to chiropractic school and after I graduated, the thing that I found that was really incredulous was that the school never prepares anybody for the amount of responsibility of what it really is like responsible for somebody else's health. So that was my first realization that I'm in the weeds. And then I had an associate position first. And then my husband, who was also a chiropractor, we bought a practice that was underserved down in Cape Cod. We flourished down there. It was fantastic. I was seeing patients and people started coming to us, and we were talked about because we were the new kids on the block and they could do something that other chiropractors couldn't do that were there. And we had new techniques, we had jovial attitudes, and we believed in wellness. And what you believe in, and the Chinese say, wherever your mind goes, your body follows. And so we believed that we could help people, and people came to us. And then from going from chiropractic, I had 10 years there. Then I went up to Boston and I had a little bit of a siesta. And then I decided to go to acupuncture school. And acupuncture school really interests me because there was two facets of it. There was actually the needles, which I was scared to death of. And then because I always hated needles for some reason. And then there was also the part of it that was all about herbs. And the herbs really interest me.
Mm-hmm.
And my ancestor was the apothecary for Marie de Medici and Henri Cotton in the House of
Mm-hmm.
Bourbon. And we took a trip up to Montreal, and I got on the train and went to Quebec City because that's where his garden was. And that's where he grew his medicinals, Louis Hebert, who settled Quebec for France. And there's a monument to him and everything else. I was fortuitously met by accident and stayed in the same place with an Airbnb person that was the historian for Quebec
For
at that time. So it was great.
For somebody considering chiropractic medicine or then going in and doing some work and studying acupuncture, what is the schooling like? How many years of schooling? What is required during the to earn your degree in either of those areas?
For chiropractic, it's the same length of schooling as Western medicine for the like med students. Then you do your specialization or your clinic at the same time that you're in school. So we don't have 8 years of it. We have while we're in school, we're starting to treat patients right away. So that was a 4 year. I did a 4 year program in 3 years.
Okay.
And acupuncture, which I started later on in life, I didn't go to it until I was 60. And then when I went, I just thought it would be a fun thing to do. Maybe it was 55. But the fun thing about it was that I had so many Western medicine courses, I was exempt from them. So I got to spend a lot of time in clinic, which I got to make friends with this person who became my mentor in acupuncture. His name is Dr. Shu. He's in Florida. He's brilliant. When I was tested and I gave an answer to something and they said, no, that's not right. I said, well, Dr. Shu told me. And they said, oh, okay, next question, because he was the master.
Didn't you?
And so it's the same year. It's a 3 year program also.
Didn't you go to school in Beijing?
I went to school in Beijing at the Olympic Training Center to study Tuina. And we worked on Olympians. They really are that tall, the volleyball team.
Mm-hmm.
I'm 6 feet and I only came up to like their armpits. I mean, it was fun and I learned a lot about acupuncture. Met a gentleman whose family is making acupuncture needles since for like 8 generations. And I have a set of those that we all bought from him. We had a tour when we were there and we got to see a lot of really very cool things. But at the training center, we learned this technique called Tuina. It's kind of like a massage technique and it helps balance out the body muscular wise and also gets rid of adhesions. And the Chinese, when they find a point that hurts on you, and because you can't speak Chinese, they're going, oh my God, it's too much. And the doctor's going like, oh, it's good for you. And I had things that I couldn't clear up. Like for instance, I one time had this like cough and I just kept on having it. And then a month later, and one of my clinic teachers there, and I said, no, I don't need vacation. I need something for this because this is not clearing up. She made a formulation for me. It literally was gone after my second drink.
4 years ago, it was about a year into the pandemic, I went to a GI doctor and I was having a lot of issues. He literally wrote a prescription pad for me to go to Hawaii. I said, Are you kidding me? He's like, no, seriously, Meredith, like you need a break. You need a vacation. Go to Hawaii. I go, this is wonderful. And I've actually framed it and I put it in my closet. And whenever my husband gives me a hard time, I point to it and I'm like, look, we need to go to Hawaii or I need to go to Hawaii. I still haven't been. But there really is something about the whole mind, body, spirit. And you're training as a chiropractor and then you're training as an acupuncturist. And now you work in functional medicine. Can you describe specifically what functional medicine is and how it differs from traditional Western medicine?
One of the things about chiropractic medicine is that you're already thinking outside the box. And then in Chinese medicine, it's similar to Western medicine, except that they look at the body more and they're looking at like what are the reasons for that. They're going, why? What's the source of that? Is it from outside, inside? Is it hot? Is it cold? And that. And functional medicine is like a branch of medicine that looks at the bioindividuality of each person. So you can have people like when someone tells me in the household that cardiovascular disease, and it's like, I already know I'm going to die from. How do you know that? And they're like, oh, because everybody in my family's died of a heart attack. And I'm just thinking, wow, what a great thing to have implanted in your brain. And I said, you can change that. You're not your constitution. I go, your constitution only if you don't like eat well, think well, move and feel better. So functional medicine does other like more functional type testing. So like for women, for instance, some estrogen tests only look at the 4 varieties of estrogen, but the full estrogen panel looks at 7, 8 of them. And it's important because it's the 7th, 8th one that has the link to breast cancer. So you can kind of see where you're at. I just think it would be a prudent thing to do. And also it gives you information because people younger and younger and younger, even men, are ending up with breast cancer that they never, where's the exposure from?
Exactly. And
right?
people aren't talking about that. So you and I talked, and I haven't shared this on the podcast yet. This is only the 2nd episode that I have recorded since my mom passed away. And I've talked about my mom a lot on the podcast, and she was a social worker and she was very much into health. Now I'll share that she died of metastatic breast cancer. And she was diagnosed the first time when she was, I want to say about 60 years old. And my aunt has been diagnosed with breast cancer. One of my cousins had a very young diagnosis of a different type of cancer. My first cousin, had 2 different diagnoses so far of breast cancer. And I'm sitting here going, okay, when's my turn? My grandmother, my mom's mom, died when she was 53 years old.
Mm-hmm.
And I kept looking, going, okay, it's time. It's going to be time. It's going to be time. That very negative syndrome that you actually call the Grim Reaper, I think, syndrome.
Yes, I do.
Yeah. But recently, a few months ago, my first cousin, when I found out she was diagnosed with a 2nd type of breast cancer, I reached out to her and she said, Meredith, don't be a Debbie Downer. Don't be the Grim Reaper. You know what? We grew up in Des Moines. And you know what? I've never had a doctor look back and think and say, okay, I understand your family history, but let's dig in deeper. Where are all of these people from? Because younger people in my family have not actually had any of these cancer diagnoses. And my cousin shared with me, Meredith, we grew up in Des Moines. You didn't grow up in Des Moines. Nobody else in our family only the Des Moines people seem to have had these diagnoses. And look, we grew up on a farm. We grew up when people were throwing crap into our water system. We grew up with all of this fertilization. My family were corn farmers. We lived in the agriculture world. I grew up on Miami Beach. So I left that conversation with my cousin, who is a very smart person, but has no medical training. She just used common sense, and she's an athlete, and she's always taking care of herself. I mean, I remember her going for like a 5K run the morning of her wedding. And I was like, oh, great. But do you think, as a functional doctor, do you think that we on the Western side, we're not looking at all of the parameters to health? We're looking at, oh, well, this is your family history, and we're not digging in deeper?
Well, a lot of things. I have this great image, and it's gross, but it's a great image. And it shows this person with a big, wide open mouth and all this food coming into it. And it says you're either feeding your health or you're feeding a disease. It's your choice. And so, because that's where we first get our nutrition. And a lot of people don't realize, they don't read labels. So they don't understand. It's like, well, where did that come from? Glycophosphates that are sprayed on foods. We won't mention a company, but they're sprayed on foods, and then you go to eat them. I was in Florida one time walking my dog, and I was doing clinical rounds in Pinella. Is that a real
Pinellas,
place?
yep.
Okay, thank you. And so I took my dog for a walk in the morning. There's this old guy out, and across the street was like a creek, and there was like his grandchildren running across the grass right after he sprayed Roundup on it.
Mm-hmm.
And I just said to him, "What's in there?" And he goes, "Roundup." And I go, "You should have a mask on." Number one. Number two, you shouldn't use it. And number three, and I said, are those your grandchildren? Yes. Well, they're running right after where you spray stuff. And I said, 65% of what you put on your skin gets absorbed into your body. You think you might want to like wash their feet off immediately?
I was born in the 70s, grew up in the 80s, 90s. Thank God it was Miami Beach, I guess, and not Des Moines, Iowa. But
Yeah.
what they were doing in Des Moines, you're right.
Yeah.
They lived in agriculture world.
And you have the biggest, if you look at anybody can find this, even if you don't understand how to read charts. When you look up the highest incidence of cancer in the United States, it's right down the Mississippi River.
Yes, actually, my cousin said that. She said her area, when she did research, it was the second highest growth rate of cancer. And so she started digging deeper and deeper into this. And she's like, Meredith, you're fine. It's all of us who grew up in Des Moines in the 60s and 70s. That seems to be what happened.
I can remember my mother making Duncan Hines cake, the first one she ever made. And I just asked her, what is it? I tasted it. I said, what is this? And she said, it's cake. And I said, it doesn't taste like cake. And I put it down. And I gave a piece of it to my dog, and my dog walked away from it. And I said, see, the dog doesn't even like it, Mom. And I said, this is horrible. I go, this stuff it tastes plastic. It just tastes fake. And so the joke with her is like, is this fake food or is it real food? Because you had that, that influence even starting like way back when, like this is easier. And they also, like when you look at like butter was used for some, like even lard. They replaced lard with shortening, and like mechanical engineering. It's just like, why? And they still make it. So why do they do that? Why do they still make margarine when they know that is highly carcinogenic? I don't understand that. Like, why is like Roundup still on the shelves? When people go, well, if you just got to use it right, I go, something that's carcinogenic is carcinogenic is carcinogenic. The woman who lived across from me in Winter Park, she used to have busloads of people come from all around the world to see her garden because it didn't require water. And I said, what'd your other dogs die from? And then she said, oh, they had cancer. And I go, you think it's from the food or the water? And she goes, oh, no. It's just their bad luck. And so after I left there, and when I came back 2 years later, I said, I just took a walk around the neighborhood, took my friend's dog for a walk. And I said, the house has changed a little bit. Oh, she died. What does she die from? Lymphoma. And she used Roundup. And we have those chemicals in our environment from a lot of other things. We have stuff in our houses that don't make them green. And you have to take a look at like, what's the labels? What's in there? This estrogen disruptor, it affects how it easily absorbs into your body. So you have to let's look at what's real in that. I have a assessment that's an environmental assessment. And I always tell people there's nothing right or wrong about it, but if you write anything down, you've got to change something.
And is that the best way to figure out in your environment or what you're eating or what's around you, how to create change, like doing some type of assessment? Because I'm just thinking, as you're sharing this story, I was in 8th grade. We lived in Minnesota, and in Lakeland, Minnesota, and we lived there for only 1 year. And the reason we moved is because we had our well tested, and the well came up as contaminated. And we had lived there for a year. My mom literally got to give back the house because it was contaminated. I don't remember. It was like the late 80s when this had happened. But I did think to myself, I don't want to be the Grim Reaper and have that syndrome. But oh my goodness, I was drinking from that water for an entire year. Like, what is a happy medium on being safe and being a little neurotic so that you can still live your life?
I'm still living my life, but When I go on site to travel, I have a zero water filter and bottle that I bring with me. And I check the TDIs, that's total dissolved solvents that are in there. And I check to see what the number is. And if it's past a certain number, I toss that filter out and I put another one in. I don't care if it's 3 weeks. I just look at it like, oh, you can let it go a little bit. No, you can't. So you have to be diligent. Also have to have things in place so you don't feel like you're being neurotic either. So, I mean, when you have like up here in New York, you can get like raw milk. You can't get raw milk other places. And I don't do, if it's regular milk, I would never drink it. Raw milk, I'll drink. And the reason, and it tastes different. You can see the cream. Like regular milk, I think can like go 2 weeks or something like that, or 3 weeks. This doesn't last that long in the refrigerator. And also, whereas I'm a little bit, sometimes gluten bothers me. When I drink milk, I don't have any sensitivity to the lactose or any of the fat in it.
Don't they say when you go to Europe, you don't gain as much weight because the bread is different than it is here? And you had mentioned gluten. It's funny that you say this because my husband grows kefir or whatever it is. I don't know. He was straining it last night. Yeah.
Kefir.
And he was using goat milk. But the price of goat milk has gotten so astronomically expensive, at least where we are. He switched to whole milk. And he will never use skim milk again. And every time we go to a coffee shop or if I'm at Starbucks or wherever, and which I'm rarely at, I'm a big tea drinker. Sometimes I'll get a latte and I'll do it with skim milk. And you can see my husband peer over at me in a condescending way. No. But he peers over and he's like, skim milk? Why do you think that whole milk is so much better than skim milk? And why is raw milk better than pasteurized milk?
Because it's not pasteurized, which means it's heated. And it's not there's not this sterilization process. There is a certain number of bacteria and microbes that can exist in milk. Likewise, when you're just drinking regular milk also, except milk is sterile. And so there's like the nutrients, when something is cooked, the nutrients go bye-bye. And those components in it, that's why it's better to do that. Do you know it takes a gallon of milk to make one little ball of mozzarella?
Good thing or a bad thing?
Well, it's good because mozzarella is good, but if you can even make it from something that hasn't been hyper pasteurized, you're having something more natural, and your body understands natural. It does not understand like BHTs, like other things that they have in there. So it's like, that's why reading the ingredients is important.
To be focused, you also created these 5 pillars of health. Where do you think people should focus to be the most healthy they can be without going crazy? What are those 5 pillars?
Well, the first pillar is proper diet, which I also consider nutrition. And then the second pillar is proper exercise.
What is proper exercise? What is proper exercise? Because I hear from so many different people, this is the amount you should exercise every single day, at least for 20 minutes, or exercise 3 times a week. What should we be doing?
You should be moving every day and doing like something. And I'm not like a person who thinks that's like, or tell people you've got to do 5,000 steps or 1,000 steps. Because some people, 5,000 steps might be too much. And it's just like, and if you're always doing something that makes you feel like you're not succeeding, then you're going to feel like a failure. So proper exercise to me, and it's also based upon body size, like our body style. Like you can see, you can almost pick out runners out of 100 people. You can go, that guy's a runner, that guy runs, that guy's running. They just have a certain body style. And then you have, and that's your ectomorph. Then you have the mesomorph, who's kind of can run maybe a little bit, but more sprinting. And then the mesomorph also does weightlifting. They have a tendency to do that. And then you have the endomorph that's plump. They're just plump, and they don't do a lot of motion or anything. So they have different body types. But the interesting thing, if you ever took a film on them, all their skeletons exactly look the same. And so that inside part is the part that matters.
So you definitely need to move every day.
You have to move.
We need to eat healthy. And what my son likes to say, because he was a food and science major at Purdue, he says, Mom, were we able to eat this 100 years ago? If our ancestors could eat it, you can eat it. But if our ancestors couldn't eat it, you need to like skip it. I said, okay,
Good.
fine. I'll focus on that. And then he shared a story about Oreos, and I'll never eat Oreos again. So,
That or Cheez-Its. I mean, there's some of those things that are they're better left on the shelf
yes.
for sure.
Yeah.
I mean, I've never seen a moldy Oreo in anyone's house. That's it's like how long have they been here? Oh, they're a little stale now, maybe a couple months. And to think that that's normal, you have to think, wow, wait a minute.
With the petroleum, they might be able to run our car.
Well, they could. I mean, some of them you can like look at like when they were having everyone sanitize their hands, right? And it's just like if you took a match next to the sanitizer, it would ignite.
So we have to eat healthy. We have to exercise every day. What
Yeah.
else do we need to do?
We need proper sleep. And naps count as like sometimes it's just good to go lay down for 20 minutes and close your eyes. You don't have to do anything, or you can count from 100 to 1 or whatever, 50 to 1 or 25 to 1 and just relax, especially if you have a condition going on. And then you have proper mental attitude and positive mindset. And I always talk and teach clients about how to start the day off on a positive note and end up on a positive note at the end of the day. Find something that's positive that you can end your day on because it will make a difference with how you sleep and how you wake up. And it affects other people who are around you. And the last thing is proper posture, which I call proper, some of it that's an offshoot of it. It's like you have to have proper mechanics, biomechanics in order to function. So like when we're sitting here, I'm sitting without a back to my chair. I have a back of my chair, but I'm sitting 6 inches into it because it's the perfect place for me to be on camera. But earlier today when I was sitting here, my up between my shoulder blades started to bother me. I'm going, I need to get adjusted. I was just like, I need to get up and stretch, and I need to like just hang, and like, can I touch my toes?
And those are so important. I look at my father-in-law, who, when I met him, was 6 feet 1 inches, and now he's probably about 5'9" because of his posture. And so it really gave my husband a jump start into building up his back muscles and doing not just strength training, but also stretching to be able to ensure that he has the flexibility, because he saw himself going down the track of his dad. And he's like, I do not want to be that way. So you're right. It's so important to be able to do that. And even with the sleep, I don't get enough sleep at night. I probably get about 6.5 hours. Last night I got 6 hours, and it's not good. And I know that. But I'll tell you, when I sleep, I feel so much better. I think I look so much better. It is a whole different mindset, and it really can jumpstart your day far better.
Well, all you have to do is just be a little stressed, have a bunch of stuff going on. You don't, even if you sleep the right amount, when you wake up and you look in the mirror, it's a very scary experience. It's an oh my God moment. And having enough sleep, if you're sleep deprived, it's like they say by papers, white paper that I read, that when you are sleep deprived, it's as if you're drunk. You have the same kind of coordination. So in a lot of accidents, car accidents are caused from sleep deprivation, not necessarily falling asleep at the wheel.
I was just at an event, Women in Healthcare Leadership event down in Fort Lauderdale a week ago. 2 of the speakers talked about how important it was to meditate and take a break. And I started doing yoga nidra meditation, which is really like sleep meditation. And I'll tell you, I got off track, and I did it twice this past weekend, once on Saturday, once on Sunday. It made me feel so much better. And I have to remember to keep doing that, because some studies have said if you can do yoga nidra even for 25 minutes, it's like getting 4 hours of sleep. Is that legitimate?
Pretty much. It's the Silva method. You do physical relaxation first, and they do it with a technique called 3-2-1 method. The number 3 is for physical relaxation. The number 2 is for mental relaxation. And the number 1 is being in your alpha state. So by the time you get to the 1, and they do this one exercise in a couple of the meditations that I do with that, where like I work on Wednesdays and Thursdays all day long. And the guy who I worked with, he goes, "You're laying down and going to sleep." I said, "I'm meditating. Does it look like, are my eyes open?" And he said, "No." And I said, "Great, leave the room." But he said, "What are you doing?" He did not understand the idea behind doing a meditation. And then when he saw me when I came out, he goes, "Wow." You look really fresh." And he goes, "How long did you do that for?" I said, 21 minutes. And he's going, "Wow." And so when I go there, if I'm looking like I'm maybe tired from the morning or whatever, he go, "You should go lay down for a little while." It's okay. I'll start with the patients in the afternoon, but you're constantly going. You've got to like give your body a break. And that's a good way to do it. I've done that type of meditation also. There's a sleep version. There's one you do in the afternoon. So I've sampled a lot of variations of meditation styles.
For people who are new to meditation and are listening to us saying, yeah, maybe I do need to take a break during the day, because I certainly need to start taking a break during the day and cutting that out, because I am so much more creative
Hmm.
and strategic when I can take that break and that time to
Yep.
myself. What's the
Hmm.
best way that somebody can start?
Lay down, close your eyes. And get in a comfortable position. So just get in a body position that makes you feel happy and comfortable. And then listen to binaural beats. If you don't like the sound of the binaural beat, change the station. That's easy. And if you just will sit down and just like lay down, put a pillow underneath your knees, put one underneath your neck, or lay on your side, whichever way you're comfortable is the way your body's telling you that it needs to be. Sometimes I lay on my back and I'm perfectly fine and I'm like out like a light. Then sometimes I do that and it's just like, no, I got to turn to the right. No, I got to turn to the left. As long as you don't open your eyes, you can move around,
I think
you
a
know?
lot of us leaders are always so overwhelmed with how much we have to do. But as I try to continue to remind myself, you call it the lizard brain, I call it the monkey
Hmm.
brain, right? You have your
Hmm.
rational brain and your monkey brain. If you don't take care of yourself, you can't take care of others. If you don't take
Hmm.
care of yourself, nobody else will take care of you. So it's important to remind ourselves that we
Hmm.
need to take care of ourselves, especially women who are the primary caregiver for our children. We're working in high stress positions. We're managing our households. We're doing everything else. It gets overwhelming.
And especially for women who have children, by the time that they get those kids to bed and they're going, oh, like I'm going to take a bath tonight. They just look at the clock and they're going like, oh, and it'd be good for them to take a bath because it will bring up the alpha state easier and you'll be able to relax and go to bed easier. I had a girlfriend who took a hot bath every night of her life since she was 20 years old before she went to sleep. And she swears by it. It helps her sleep and it helps her body's happier. And we have to start taking more baths anyway. It's so good to have it. Like if you go to a spa and if you go into like a hot bath, it's very good and nurturing for your body, not only for your body, but also for your mind. It's easy to put you in a relaxed state.
I am addicted to baths. My mom
Mhm.
always took a bath. We moved into the house that we live in now, and I was building out the bathroom. I actually laid in bathtubs to make sure
But
I was choosing the right one.
they have to be comfortable. And a lot of American bathtubs have the pipes in the front. European bathtubs, the pipes are on the side. So you could get in if you feel like you want to change your view, you can lay at the other side. But it's just, yeah, and to have them long enough so you're not like having your knees in your
Hmm.
face, they're it's so nice to take a bath. One of the things when I travel, I always look for when they give me a room and I said it has a bath in it, right? I want a room with a bath.
I always do
Yeah.
that. I will pay more to stay at a hotel to get a bathtub. My husband has made phone calls to numerous hotels to make sure that there is a bathtub, because I am very
Hmm.
much a bath person. And it's funny because my son is engaged and his fiance is like, "Oh, yeah, you do like baths, but do you shower before you go in the bath?" Well, what do you what, she she's worried that you bring the dirt with you in the bathtub. So how would you respond to Samantha? Because she does listen to the podcast. And so I'm going to let you speak directly to Samantha.
Samantha, how are you today? But I've made it to 71 and I haven't died yet. So
I love the
I,
bath.
I
I
love
need
the.
bubbles for my birthday.
It is. It's just like you can close the door and it's like you're in your own element. When we all came, we used to have a bath for 9 months when we were newborn, conceived until we came out. Then we like you still had a bath.
Mhm.
I've never heard of that from anybody.
Well, that's what I said to Samantha. I said, well, when you have a baby, don't you put them in the bath? You're not like carrying the water along with you. So now Samantha knows you do not need to take a shower before or after the bath. You can just go
But
ahead
definitely
and take the bath.
the idea is it's going to go down the drain anyway. And you do use a clean towel, right?
Yes, exactly. Let's talk about women specifically in healthcare because we started this podcast episode talking about chiropractic medicine, acupuncture, more Eastern styles, and then going into functional medicine and how we can follow the 5 pillars of health and take care of ourselves. But women aren't always treated in the same fashion as men when we do go to the doctor, when we do have symptoms, when we do have issues. There is a disparity. And I love being a woman and I'm not a woe is me type person. But when I did this research and saw that the NIH, the National Institutes of Health, did not include or require women to be included in clinical trials until 1993, I was baffled. So all of these,
Wow.
yeah, did you know that?
No,
Yeah.
that's a wow.
I interviewed somebody about a year and a half ago, Amory Grammer, and we talked about that because she worked for the NIH and she had done a ton of research on
Oh
it.
my
And we
God.
specifically discussed this, and I couldn't believe it. And I did my own research after the episode, and I was like, oh my God, most of these treatments that we're looking at now were based on studies done for men, especially when you're looking at cardiovascular disease. They were focused on men, and the male anatomy obviously is far different than the female anatomy. But I know myself, men are never called hysterical, women are, right? Men are never called bossy, women are. And when we go to the doctor and we try to assert ourselves, sometimes we are dismissed. And it actually, I did a little bit more research and I learned that 20 to 30% of women are more likely to be misdiagnosed than men. I was sort of shocked by that. What do you attribute that to? You've been practicing medicine for, well, longer than me because I've never practiced medicine. But what do you attribute this to?
Well, women are more detailed than men. So, like when you're asking, like generally speaking, so when you ask a woman, like we pay attention to minute things, like when you go into someone's house and you're saying, what did their house look like? Oh, she had this beautiful white couch and she had this, oh my, it was so dainty. It was nice white, blue, and red, like throw that was over on the end of it. So like you have a way, women have a way to explain those types of things more intricately. And I think that men have a tendency to turn off when we start going through that list, because they want to know the end of the story and they want to know. And that's even in medicine. I've had that same experience myself. And when someone even knew that I was a physician, I'm like, no, I'm pretty sure. But my female physician that I had, when I had shoulder pain one time, I said to her, I researched it out. And she goes, where's the shoulder pain? And I go, it's unexplained. Came on, it was insidious. And I'm explaining to her this, and I'm going through the detail when I lift my arm up this high. So by the time that you tell the same thing to a man, they already decided what you got going on with you.
No, but that doesn't attribute to the fact that women are 20 to 30% more likely than men to have a medical condition misdiagnosed or diagnosed later.
I know. Because the thing is when somebody, you have to look at who's listening to the symptoms. And so if they're listening to the symptoms and, when they hear keywords that they want to hear, then they go down that route in differential diagnosis. You just like when you have that one word, you're like, oh, you have that? Is it in the morning or at night? Is it like when you urinate, is it yellow? Is it clear? How clear is it? Is it clear all day long? How much water do you drink? And then then the question is like, oh, do you drink coffee too? Oh, that's probably why you're going to the bathroom so much.
But I don't think women, female doctors, should be let off the hook when they're listening to women. I had an ulcer. The doctor dismissed me as, you know what? You're fine. I'm like, listen, I don't typically look like I'm 5 months pregnant when I'm not pregnant. And so, long story short, I ended up with a duodenal ulcer.
Mm-hmm. Well, I think a lot of times people forget, like what we don't have on the planet Earth is a lot of really good general practitioners. And the general practitioners were the buffer. And I think that maybe a lot of physicians forget how to diagnose, because when you have a working diagnosis, it comes from what the patient tells you. And if they're not listening and they're already on the next piece or on the next appointment, or they got to get you out because your 15 minutes is up, their ability to assimilate what you're saying becomes diminished. So it's really important that when you're utilizing your time and utilizing your ability to speak for yourself, that you're really clear in what those symptoms are, even if you have to write them down and read them, make a copy of it and give them to the doctor so that they can look at all the symptoms that you're experiencing and times and dates. And I wake up at 3:00 in the morning and I have stomach cramps or whatever it is.
I like your perspective in the patient being their own advocate and making sure that they're providing the best narrative or the best triage for their condition. Because if you're not explaining it and you're not speaking up for yourself, who's going to? If you could create one change within our American healthcare system to get us to a better way, so we are no longer practicing sick medicine, right? Sick care medicine. What would that be? What would you do to fix the American healthcare system?
Well, there's a couple things. First off, I think that we have to create a language that everybody understands, and it's not a deep, dark secret. And I think we have to have better alternative health care plans. So, for instance, what people eat, because nobody knows how to eat in this country. And considering that is where you get your main nutritious source from, then that's where we have to start. We have to start with the food that we eat, the air that we breathe, the water we drink, and start saying no to things that just don't make sense, that are out to kill us.
I love that answer. Thank you, Pat, Dr. Pat, for joining me on Working Healthcare. If this conversation hit home or made you think a little differently, don't keep it to yourself. Share the episode, tag a friend, or post about it on social media. Connect with me on LinkedIn to keep the conversation going in between episodes. If you've got a question, an episode idea, or someone you think I should feature, send me a note at meredithhirsh.com. Thank you all for the 5-star reviews. They help more listeners find the show. New episodes drop every Tuesday. Subscribe so you don't miss what's next. Tune in weekly as we explore the inner workings of healthcare, because you can't fix what you don't understand.